thank you for joining us to discuss 6 tips on how to maximize recovery following a stroke. For many, recovery starts the second a stroke is suspected for the best possible outcome. A key component to your recovery is choosing a top care center for your rehabilitation. Whenever possible, you want to be as involved in inpatient rehabilitation, such as Highlands Rehabilitation Hospital, following a stroke. Data suggests that the more acute intensive rehabilitation you receive after a stroke, the better the outcome will be.
Seek emergency care when a stroke is suspected. Patients who arrive at the ER within 3 hours of their first symptoms tend to have less disability months after stroke than those who receive delayed care. If you feel worried about clogging the ER or you want to wait it out, you could be delaying life-saving care.
Stroke can affect parts of the brain responsible for cognition and communication, leaving a patient unable to tell the doctor their medical history. Carry your patient health profile that lists medical conditions and any medications you are taking. This piece of paper carried in your wallet might contain vital information that doctors can use to ensure you're on your way to an optimal recovery.
Compliance is key. Please remember to see your primary care physician for regular follow-ups. Your primary care doctor is essential for your recovery after a stroke to make sure that your medications and your health issues are being addressed properly.
A healthy and consistent diet is crucial when recovering from a stroke. One reason food choice is important is because of patients in early stages of recovery may experience weakness or incoordination of swallowing muscles. A care team might recommend soft foods or thickened liquids because swallowing problems can lead to fluid aspiration and possible pneumonia.
We urge our patients to keep their lives as stress-free as possible after stroke, not implying that leading a stressed life in some way contributes to stroke in the first place, but keeping your life balanced without undue psychological pressure is associated with better outcomes.
For every stroke patient, treatment at a rehabilitation comes to an end. When you continue onto the outpatient setting, it is essential you do your homework, otherwise known as a home exercise program, assigned to you by one of your rehabilitation care specialists.